I'm Dr. Eugenia Romano, and my CRIS project is about health inequality and people with mental health problems, such as people with bipolar disorder or schizophrenia. So the way our healthcare system works is that professionals in the healthcare system receive economic incentives to check group of patients on specific health indicators which are of interest. What we want to see with this project is if people with mental health problems are regularly monitored on these health indicators that are specific to their category, as they should, compared to the general population. The way we do it is thanks to a resource which is unique to our research group, which is a wide linkage of information from general practice and mental health resources. This brings together many kinds of information such as demographic factors, medication, diagnosis, and thanks to this we have a lot of profiles of patients that we can look into. All of this is anonymized to preserve the privacy of the people. So the first step of this project is to compare general population and people with mental health problems on the recording of health indicators. So it's just a simple comparison. Once we have this, we can also look into different subgroup of patients. So whether this differs if we consider people with schizophrenia or people with bipolar disorder. And on top of that, we can see whether the frequency of recording of these health indicators in turn predicts the likelihood of developing certain chronic conditions like obesity. Also, we can see if the frequency in which these patients are recorded also impacts the likelihood of them getting referred to health programs, for example, weight management or physical activity. And also we can have data that are tailored to specific subgroup of patients. So if it differs for people with depression or bipolar disorder or schizophrenia, and hence have data that are more specific to these subgroups of interest. This project is important because people with mental health problems often struggle to access equity of healthcare. Sometimes they're left behind, maybe they struggle to actually attend GP visits for economic reasons or psychosocial factors. And this study will help us see why they don't receive the healthcare they actually need. And in doing so, we can see what are the limitations, what are the barriers for this group of patients in accessing healthcare resources, and what we can do to actually help them overcoming this and get better help.